I'm Steve Fisher, your 2023 OKA president, and back with you today for your October membership update. Three items I want to touch base with today. First, just to let everybody know that the renewals portal is now open, so you now have the opportunity to renew your membership for the 2024 year. Certainly look forward to any feedback that you have on your 2023 membership. And always looking forward to trying to find ways to add more value so we can give you more bang for your buck. One quick note on the membership renewals, you will notice that the fee looks a little higher this year. And again, if you watched my update in September, it's simply because the CKA portion of the fee that you would have paid when you purchased insurance through ProLink is now being collected by the OKA. So you'll see an increase in $45. Again, that's not an OKA fee increase. It's just a change in the OKA now collecting the CKA fee rather than ProLink. A number of reasons for that, and happy to connect with you if you have more questions. The second item I wanted to highlight, if you are watching this video and it is not yet November 9th, please be aware that our OKA AGM is taking place on Thursday, November 9th at 7 p.m. We have a very thorough update. If you've been following my updates, my monthly updates through the term, we'll touch base on a number of those items and maybe fill in some of the other initiatives that are going on alongside those. But again, if you are viewing this and it is not yet November 9th, please email the OKA, get added to our AGM list. Love to have you there and to give you the update on and summary of all of the year's successes. Three, the last thing I'd like to do is highlight a really great opportunity that the OKA had. We spent a day last Thursday, at Queen's Park. Had a wonderful opportunity to visit with a number of our MPPs. As somebody from Waterloo, I was very proud to have my MPP, Catherine Fife, standing up and saying a few kind words to us and to the kinesiology group, and to listening to some of our ideas and thoughts, as well as MPP Robin Martin, who's the parliamentary assistant to the Minister of Health. Had a number of great conversations with Robin. So really excellent day. And what I'd like to do is just leave you with the words that we were able to share to our MPPs through our opening address and showcase some of the pictures highlighting the different conversations and summarizing kind of what was happening there. So for the remainder, for the next 3.5 minutes or so, I'd encourage you to listen along and you can kind of hear the message that we had pitched and move forward and continue to promote to our MPPs through government. Look forward to reconnecting with you again next month and hopefully see many of you at the AGM. So I'll turn it over now and we'll share a summary of the notes that were highlighted. Thank you, everyone, for being here today. I'm Steve Fisher, the president of the Ontario Kinesiology Association. To our members of provincial parliament and staff, we appreciate you taking the time to hear from us. To our OKA board members, thank you for joining us here at Queen's Park today. We are all here as our health system continues to struggle with health human resources. We all know about the huge demands being placed on our frontline healthcare workers. Across the system, doctors and nurses have enormous demands in their time and not enough of it to go around. At the same time, the OECD estimates that nearly 4 of every 5 nurses and 3 in 4 physicians are performing tasks they're overqualified for. We also know that they're performing some tasks they may be underqualified for. Exercise, for example, is one of the most powerful health promoting tools available. In fact, the Public Health Agency of Canada is clear that exercise and physical activity can help manage and prevent more than 25 chronic conditions. That includes both physical and mental health conditions. Yet, as few as 1/3 of Canadians say they were even counseled on exercise last time they visited their physician. Many physicians and nurse practitioners say they aren't sure how to build customized programs to improve their patients' care outcomes, or where to send patients to get the support they need. In multidisciplinary care, the goal is for health guidance to come from the professionals most qualified to give it. Rather than asking our primary care frontliners to make decisions about exercise, we should prioritize those professionals with the right scope of practice. Kinesiologists are Ontario's regulated exercise and movement experts. We know how exercise can achieve chronic disease prevention and management and support injury rehabilitation. We have the expertise to help ease the burden on the healthcare providers and improve health outcomes. As we celebrate this 10th anniversary of the proclamation of the Kinesiology Act, now more than ever, registered kinesiologists should be essential members of primary care teams. We can help Ontarians with diabetes management, a condition that's all too common, affecting 30% of Ontarians. For those of us recovering from stroke or heart conditions, kinesiologists can help build a path back to activity. Many of the most common car accident injuries are pains and strains that kinesiologists can treat, yet outdated regulations create duplication and unnecessary red tape. Kinesiologists are regulated health professionals with knowledge gained at universities across this province. At the OKA, we represent more than 1,500 kinesiologists. We're trained, qualified, certified, and ready to take on more of the health human resources burden as Ontario grows. If we're going to get through this difficult time in Ontario healthcare, we need all hands on deck, working to their full scope of practice. As kinesiologists, we're ready and willing. We're calling on you, MPPs and decision makers, to work with us to integrate kinesiology and clinical exercise into the system in the myriad of places where exercise can help. From primary care, to secondary care, to tertiary care, in hospitals and aftercare in the community. If clinical exercise can cost-effectively improve health outcomes, then it should be part of the care plan. Again, we look forward to continuing to work with you to make this happen and appreciate you joining us here today at Queen's Park. Thank you. So again, hope you enjoyed hearing some of the words and some of the messaging that we were sharing with our members of provincial parliament at our Queen's Park Day last week. As always, please reach out if you have any questions, comments, or ideas, or maybe want to get involved in a future Queen's Park Day as we begin to map out our advocacy plan for 2024. Hope everyone had a safe and happy Halloween. Hope everyone has an enjoyable transition here into November and the fall season. And I look forward to seeing everyone soon, hopefully on November 9th at our annual general meeting. Thanks. Have a great evening.